Gentlemen, imagine waking up tomorrow with the kind of natural firmness you thought was long gone. No pills, no devices, no risky treatments, just your own body working the way it's supposed to. For many men over 50, fading morning erections feel like an unavoidable part of aging. But the truth is, your body hasn't lost the ability, it just needs the right kind of wake-up call. I'm Dr. Sophia Carter, a urologist specializing in men's health. Over the years, I've seen hundreds of men in their 50-second, 60-second, even 70-second retrain their erection system naturally. And in this video, I'm going to share 3 specific pressure points you can stimulate with your hands that help restore firmness by boosting blood flow, relaxing the right muscles, and sharpening nerve signals. By the end, you'll know exactly where these points are, how to activate them safely, and how often to use them. Think of it like physical therapy for your manhood, simple, natural, and completely under your control. Stay with me, because once you understand how this works, you'll realize you have far more control over your vitality than you think. Before we get into the pressure points, let's quickly understand why this works. Erections aren't random. They're the result of a finely tuned system. Your brain, spinal cord, nerves, muscles, and blood vessels all have to communicate perfectly. Here's how it normally happens. Your brain or sensory nerves send tiny electrical signals to the erectile tissue. Those signals tell smooth muscles inside the penis to relax, which allows blood to rush in and fill chambers called the corpora cavernosa. As they fill, veins that usually drain blood get compressed, trapping blood inside, creating firmness. But with age, 2 major changes occur. First, blood vessels lose elasticity, often due to wear and tear, inflammation, or conditions like high blood pressure. Second, nerve signals slow down. Together, this double hit makes it harder for your body to trigger strong, automatic erections, especially in the morning. This is where targeted pressure points come in. By stimulating very specific areas, you're not just touching skin, you're activating nerve clusters that connect directly to the pelvic nerve plexus and erection center in the spinal cord. Think of it like jump-starting a car. The signals travel faster, the blood vessels open wider, and circulation improves instantly. Understanding this science matters because once you realize you can reawaken the system, you stop feeling like you're broken. You're not. Your body simply needs a reset, a reminder of how the process is supposed to work. Stay with me, because in the next part, we'll talk about the first pressure point that acts like your body's hidden control hub. As men age, one of the biggest challenges to sexual health is what I call the double hit. On one side, circulation slows. Over time, arteries stiffen, losing the flexibility they had in your younger years. This is accelerated by high blood pressure, mild inflammation, or simply decades of wear and tear. With less elastic vessels, blood doesn't flow as quickly into the pelvic region. On the other side, nerves also lose efficiency. Those lightning-fast electrical signals from your brain and sensory receptors don't travel as strongly as before. Think of it like an old internet connection still working, but with noticeable lag. When the messages arrive weaker or slower, the erectile tissue doesn't get the clear signal it needs to fully respond. Put those 2 issues together, sluggish circulation and weaker nerve conduction, and you've got the main reason morning erections fade after 50 or 60. It's not that your body is incapable. It's simply running into delays and roadblocks that prevent everything from firing at once. The good news is that targeted pressure point stimulation bypasses some of this slowdown. By activating sensory nerve endings directly, you can send a wake-up call that travels to the spinal cord's erection center and back. That kickstart not only improves blood flow, but also reconditions the nerves to fire more efficiently. Think of it like rebooting a computer. You're clearing out the lag and getting the system to run smoother again. And the longer you practice, the more responsive your body becomes. Next, I'll reveal the first pressure point located at the base of your manhood that acts like a central hub for both blood flow and nerve signals. The first pressure point is called the base groove. You'll find it at the root of your manhood, right where the shaft meets the pubic area. If you run your fingers along the underside toward your body, you'll feel a slight groove, almost like a natural hinge. That's the spot we're after. Why is this point so powerful? Beneath the surface lies a dense network of sensory nerve endings, along with key blood vessel junctions that feed directly into the erectile chambers. In other words, this tiny area is like a control hub where circulation and nerve signals meet. Stimulating it is like flipping a switch that turns on both systems at once. Here's how to do it. Place your thumb directly over the groove while your other fingers cradle the back of the shaft for support. Apply gentle but steady pressure enough to feel the tissue, but never painful. Start with small, slow circles. As you continue, you may feel warmth, tingling, or even a subtle fullness. These are signs that blood is moving and nerves are responding. If you don't notice much at first, don't worry. Just like exercising a muscle, results come with repetition. Try working this point daily in the morning or during a warm shower. Over time, your sensitivity increases and your body learns to respond more quickly. Think of it as reawakening a forgotten pathway. By training the base groove, you're essentially teaching your erection system to communicate better, helping you regain the firmness you thought was gone. In the next part, we'll move to a hidden powerhouse spot most men overlook, the perineum. The second pressure point isn't on the shaft at all, it's in a hidden but incredibly important spot, the perineum. This is the soft patch of tissue between the scrotum and the anus. Many men ignore it, but when it comes to erection strength, it's a secret weapon. Why? Because right underneath lies the bulbospongiosus muscle, one of the key pelvic floor muscles. Its job is to trap blood inside the penis during an erection, acting like a natural clamp. When this muscle weakens with age, blood escapes too quickly, making erections less firm. By pressing and massaging the perineum, you actually wake up and strengthen this muscle reflexively, almost like doing pelvic floor exercises without the workout. Here's how. Sit comfortably or lie back with your knees apart. Using 2 fingers, press gently but firmly into the center of the perineum. Don't push so hard, it hurts just enough to feel the muscle underneath. Make small, slow circles for 2-3 minutes. Many men report feeling warmth spreading toward the penis or even a subtle pulsing sensation. That's blood flow improving and the pelvic muscles kicking in. For even better results, pair this with simple Kegel exercises contracting and releasing the pelvic floor before or after the massage. This double approach doesn't just help you in the moment. It reconditions your muscles to hold blood more effectively during arousal. The perineum may be out of sight, but it should never be out of mind. Simulating it daily can dramatically improve erection quality and control. Next, we'll look at the most sensitive point of all, the corona ridge beneath the head. The third and final point is at one of the most sensitive areas of the male body, the corona ridge, the ring-like edge where the head of the penis meets the shaft. This spot is packed with thousands of nerve endings, which act like messengers carrying arousal signals to the spinal cord's erection center. When stimulated the right way, the corona ridge can retrain those nerves to respond more quickly, making it easier to go from arousal to a firm erection. Think of it as tuning up your body's arousal system, removing static and sharpening the signal. Here's how to do it safely. Gently grip just beneath the head with your thumb and forefinger. Lightly pinch the ridge and hold for about 5 seconds, then release. Repeat this rhythm for 1 minute. Afterward, switch to slow circular motions around the ridge, gliding your fingers gently without irritating the skin. What happens is twofold. The holding technique wakes up the deeper nerve pathways, while the circular motion stimulates the surface nerve endings. Together, they encourage faster, stronger communication between your brain and your body. Be careful not to overdo it. Too much pressure or intensity can overwhelm the nerves and backfire. This is about gentle, controlled activation, not force. Over time, with consistent practice, men often notice stronger morning erections, greater sensitivity, and a more natural response during intimacy. It's like reminding your body of how things used to work in your younger years. Now that you've seen all 3 pressure points, let's put them together into one simple routine that only takes a few minutes a day. Now that we've covered all 3 pressure points, the real power comes when you combine them into a daily sequence. Think of it like a workout routine. Each point targets a different muscle in your erection system, and together they create balance, strength, and responsiveness. Here's the simple flow I recommend. Start with the base groove for about 90 seconds, making slow circles until the area feels warm and relaxed. Then move to the perineum for 2 minutes, pressing and massaging steadily to activate the pelvic floor muscles. Finally, finish with the corona ridge for about 2 minutes. First the hold and release technique, then gentle circular strokes. In just 5-6 minutes, you've improved blood flow, woken up the nerves, and strengthened the muscles that hold everything in place. Done consistently, this retrains your erection reflexes, almost like rebooting an old system and teaching it to run smoothly again. But let's set realistic expectations. This isn't magic overnight. Most men start to feel subtle changes after 2-4 weeks. A little more warmth in the mornings, firmer fullness, or erections that last longer. Over months, the improvements stack up as your body adapts. To maximize results, pair this with healthy habits. Stay hydrated so your blood has the volume it needs to circulate well. Add pelvic floor exercises like Kegels a few times a week. And don't overlook nutrition foods rich in magnesium, zinc, and healthy fats support blood flow and hormone balance. When these lifestyle steps combine with daily pressure point work, the results are far more powerful and long-lasting. Next, we'll wrap it up with final thoughts on how to reclaim your confidence naturally. Gentlemen, weaker or fading morning erections are not something you have to simply accept as a normal part of aging. Your body still has the ability to respond, you just need to give it the right kind of support. By stimulating these 3 simple pressure points each day, the base groove, the perineum, and the corona ridge, you're directly improving circulation, reawakening nerve pathways, and strengthening the pelvic floor muscles. Together, they form a natural system that restores what time has taken away. The key is consistency. A few minutes daily may not seem like much, but over time it adds up to major changes. Most men who stay committed notice better morning fullness, stronger erections during intimacy, and an overall boost in confidence and energy. And remember, your sexual health reflects your total health. Staying active, keeping stress under control, eating foods that support circulation like leafy greens, nuts, fish, and berries all multiply the benefits. Even something as simple as walking 20 minutes a day can improve blood vessel flexibility. This isn't about chasing quick fixes or relying on risky treatments. It's about giving your body a safe, drug-free way to work the way it's designed to. So take back control. Start today. Build this into your daily routine and let your results speak for themselves. Because when your body works better, your confidence, your relationships, and your quality of life all rise with it.